So I talked to one of the nurses here about what kind of arrangements they make for family members when a resident is here and actively dying. She said that every room does have a pull-out couch, and they provide linens for the family members in addition to toiletries to be able to shower. Most of the toiletries are donations from the community. There's no limit on how many people can be visiting here at one time. So she says frequently there'll be 8 to 10 people in with one patient, and frequently they'll all spend the night. She says it's very patient and family centered, so it's based on the wishes of the family and the patient. So they really try and just cater to those families while they're in the end of life process. They do occasionally have pediatric patients. So of course there would be a lot of family members here with the pediatric patients. In addition to that, they do have a playroom for the children of the patients or family members who are here dying, so that the children can take a break from that and just go in and have a little time with some recreation. I asked about how chronic conditions such as diabetes are managed here, because one of the main focuses of hospice is to limit unpleasant interventions such as needle sticks. She says generally if the patients have 6 months or longer to live, they go ahead and monitor the CBGs. This is out in the home care, and administer insulin as directed. But generally by the time they get here, they have 6 months or less to live, and she said that there are such great physiological changes in the body that it's not usually necessary any longer. Because the PO intake decreases, the blood sugars usually stabilize, and so it's not necessary to monitor or to give insulin any longer. I asked also about what happens when a family's wishes conflict with the patient's, and she says that as long as the patient is alert and oriented, they will always defer to the patient's wishes. Sometimes that doesn't, if the patient becomes disoriented, the family becomes upset, and then the patient does wind up getting transferred to the ER in spite of the DNR form and in spite of the MOST form. If the family really desires it, the patient can be transferred for medical care. She did point out that sometimes, even in end-of-life, medical care is necessary for something like a urinary tract infection, which can cause discomfort to the patient. They transport them to the ER so that they can get medications so that they will be more comfortable. She also said that education for the families is very important here, that when the patient is first admitted, the family gets a book that discusses end-of-life processes, and usually going through the book with the family, they will recognize signs in their family member and realize that their family member is at the end of life. But she says it is an ongoing process, because people will appear to understand and then have to be re-educated, and also new family members are always coming in, and so the education process starts over. So for the family, it is a continual educational process here at hospice.